toxins from the blood in people whose kidneys can no longer perform these functions naturally. This is referred to a renal replacement therapy, and the first successful dialysis was performed sometimes in 1947, and it has been of great help all through for very many people. And so that means there's some element of success in this. You march into this room, and there's so much life. The patients, are happy. They're enjoying their meals. It's because hope has been sold to them. And so we just get to understand how important is dialysis process. And Dr. once again, I am coming to you, and I know this is the dialysis machine. I guess it's now for you to tell us just exactly what is, dialysis process in layman's language.
Yeah. Dialysis process is a procedure which is done on patients which the kidneys has failed. And we have many causes of kidney failure, but we have two primary causes of kidney failure. One of them is hypertension, poorly controlled hypertension. Secondly is poorly controlled diabetes. Those are the major causes of the chronic kidney failure.
Okay.
And we have another one called acute kidney failure, which is this can be resolved if dialysis is done early enough. The patient will come out of the kidney failure, and they go back to their normal life. But the chronic one, there's something like a lifetime. You will need dialysis for lifetime or transplant.
Often,
Yes, or transplant.
Okay.
Yes.
All right.
We have a transplant. We can do transplant but it's an expensive procedure, but it's available in Kenya. In many hospitals they do now.
So for that is a lifestyle. How often does one then need dialysis? After how long?
Because now most of patients who are doing dialysis, they're using NHIF card, and NHIF card provide for 2 sessions per week, twice per week.
Okay.
Yes.
So how long does the session take? For instance, I've just seen one of the patients walk out. They're done with the procedure?
Yes.
Also, every time they come for that, and then they know that I'm done with the procedure, and they exit.
Yes.
So it is necessary that they have 2 sessions per week, or even more?
Even more.
Even
we recommend 3, but because of the financial issues,
yes.
So we do 2.
And this keeps them going? It sustains them?
It keeps them going.
All
They keep them strong. They do their normal duties, which they used to do. Yeah.
Maybe we should have started by saying what causes kidney failures.
Yeah. What causes kidney failure? We have 2 types of kidney failures. We have what called chronic kidney failure and acute kidney failure.
Okay.
In the chronic kidney failures, we have major causes of chronic kidney failures are hypertension, poorly controlled high blood pressure, which is called hypertension, and also poorly controlled diabetes. Yeah.
Okay.
Yeah.
All right. Well, fair enough. So once you are told that you're supposed to go through a dialysis process, it's a process, right?
Yes.
What should go into your mind? What should be the expectation? What are some of the questions that one needs to ask the doctor? And in terms of finances, like you rightfully put it, it could be an expensive affair.
Yes.
What does one need to prepare for?
When a patient is being recommended by a doctor to do dialysis, first of all, we usually encourage them to update their NHIF cards.
Okay.
So that they can use the card to do the procedure. And also, before we start dialysis, there's a procedure of doing what we call catheter insertion. Okay. Catheter insertion is a pipe which is being inserted in the body so that we use it during the dialysis. Yes.
You said the dialysis takes how long?
It takes 4 hours.
4 hours.
4 to 6 hours. Yes.
All right. And once you're done with that, then the catheter is removed?
No. This is something which is inside the body.
Okay.
It stays in the body.
It stays in the body.
Yes.
Yeah.
All
right. So here we are, and this is the machine.
This is the machine. Like this machine is called Cabro.
Yes.
Cabro AK98. We have several machines. We have another one called Nipro, like that one. That's a different type, but they're doing the same.
They're doing the same thing.
The same thing.
Okay. This is also Cabro.
This is Nipro.
Okay.
This is Nipro.
Okay.
Yes. This is the machine which we come and this is the machine which a patient uses for 4 hours doing dialysis.
Okay. Well, could you please briefly take us through what this machine does, what this is,
Yes.
that appears like blood. At some point in time, I've seen you putting water inside that bag. We probably just need to have a brief understanding of that.
This machine, we usually do what we call disinfection. After, like, now this patient has gone home,
Okay.
you have to do what we call disinfection. You're seeing this machine it's requesting.
All right. The process has already started.
It's on the, yeah.
I have seen something written right there on the wall.
Yes, yes.
Renal machine disinfection chart, Monday and Thursday,
Yes.
Tuesday and Friday,
Yes.
Wednesday and Saturday.
Yeah.
Okay.
So we do that disinfection so that we prepare the machine for another patient who may be coming.
Okay.
So we have 3 to 4 items here. We have what we call bloodlines. These are the bloodlines.
Okay.
You are seeing these ones. We have what we call this is the dialyzer. This is now the artificial kidney.
Okay.
The artificial kidney. This is now
this one is supposed to boost your actually.
This is the one who's doing the dialysis. This is the artificial kidney now.
Okay.
And we have what we call SKF, this acid concentrate. And you have what we call bicarbonate salt here.
Okay.
And you have what we call water. There's a water from water plant. We have a plant behind here. There's a water which comes through these pipes.
And so it's connected. I can see somewhere, right?
Some pipes there.
Okay, connected to, all right.
Yes.
So if that water is coming from that, and why would we need another, bag of water there?
There's what we call conductivity in this machine.
Okay.
It has to mix that water from the water plant. It mixes with the acid concentrate and the bicarbonate, so that they are able to mix with the blood, which are dirty, and they clear.
So what exactly does it mean when you say that a patient is on dialysis?
It means that this patient, it means that the kidneys has failed, and that's like a treatment. Yeah.
All right.
Yeah.
And so as you're going through the dialysis process, do you have to take other medications, or like do you have to take other medicines, or does the doctor prescribe something else that you would be taking even as you go through the process?
Yeah, because if the cause of the kidney failure was high blood pressure or diabetes, the patient should continue with this medication as prescribed by the doctor.
All right.
And also we have a medication to boost the HB of the patient, the blood levels. Patient with the kidney failure, they usually have low blood levels.
Okay.
Yes, because the kidney is the one which produces what we call erythropoietin, the one which processes the blood. So when we have the failure, so that it's not able to produce the erythropoietin, so the patient will be having low HB, which is what we usually call anemia.
All right.
Yes. So we usually give a booster known as iron, and also we give what we call erythropoietin, artificial erythropoietin.
Okay.
Yes, to boost the blood levels.
All right.
Yeah.
So how long can one survive on a dialysis?
So far, we have seen people even who are going more than 30 years.
Could be having kidney difficulties. Very important that you stay woke. Long run.
If you follow your dialysis prescription, you follow nutrition, because also dialysis need a lot of nutrition counseling.
Okay.
Because this patient with dialysis kidney failure, you're not taking the same meals that other people who are normal people are taking. So long as you follow the prescription of dialysis, and also you follow your nutrition well, you'll do well.
Right.
Yes.
So once someone marches into this unit,
Yes.
what happens? Say I'm supposed to undergo a dialysis, and a majority of them who probably have gone through a couple of procedures could be knowing what is expected. Like I have just seen the patient saying, I think I am done, I am set, it's time for me to step out. What goes into one getting into this unit, and what is expected of them, and what do they understand first if it's a first experience?
In the first experience, usually we have a counselor who usually explain the procedure to the patient.
Okay.
So when the patient is coming here, he knows what's supposed to be done. Like most of the patients, when they enter here, they come and take their weight. We settle them in bed. We do their blood pressures. We see how their pressures are doing. We do blood sugar if they are diabetic patient. And we proceed with the procedure.
What is this?
Eh?
What is this?
This
That
one
looks reddish.
after patient has finished the finished dialysis,
Okay.
we do what we call a retrans. We return like now you're saying the blood is going there. We return the blood back to the patient.
Okay.
So this is the color of the blood through this inside these pipes. Yes. So these are only just water. This is normal saline.
Oh, this is water.
Normal saline. Yes.
So this is the cleaning process. It's ongoing or what?
We are finished now. I am supposed to remove these lines.
And then there's a way that they are cleaned differently from the disinfection that you're talking about?
Yes, we wipe the service. Yes.
Okay.
Yes.
Okay. Thank you so much once again for speaking to us. And we ask on this, you had spoken about the fact that before we resort to, a patient undergoing dialysis, there are other ways of managing the situation.
Yes.
When you say that, what exactly do you mean? And what are some of these procedures that one can take to ensuring that they're able to manage this before they decide it's a dialysis?
Yeah. Thank you for that question. Usually we usually like avoiding dialysis. So usually what we do what we call we manage what we call slow progression of to go to dialysis. So most of them we use drugs, we use nutrition, and also use follow-up. Something like weekly or twice per week. Patient is being reviewed, see how we can manage it, because as much as possible, dialysis is available. We usually like to avoid. We usually go to dialysis when it's unavoidable. Yeah.
All right. When you speak about that, then it clearly means that there are probably some risks to it.
Yes.
What are some of the notable risks for when that will be experienced in the event that someone goes through a dialysis process probably for a long time?
Risky. In dialysis, some risk is like infection because of the catheter, that pipe we are putting here.
Inside.
Most of the time, because of the skin, we have a bacteria in the skin, they usually get some infection. So that can be risky to the patient. And even some of them are being admitted, managed by antibiotics in the ward. And also, another risk. Some patients, they feel very tired. We have also risk of low blood pressure. You're going to some patient, if you try to put in a machine, the PP usually go down. So it's very important. So when you're doing dialysis, we usually check the pressures after every 1 hour.
Okay.
Yeah. Also doing this dialysis, some patients they get anemia because of usually do some few blood.
Okay.
Yeah.
All right. Okay, a couple of times blood, has to be lost, and well, that would make sense. But then, like you rightfully put it, in that case, it is important to balance this with the nutrition aspect. Make sure that you eat foods that are rich, in say zinc, rich, foods that would be able
to. And also, we have many food which the patient should avoid.
Yes. Oh yeah.
Yeah, many food like bananas.
They should avoid bananas.
Guache.
Potatoes, sweet potatoes, chipos.
Yes.
Why? Why these ones in particular?
Because they have what we call high potassium levels.
Okay.
And somebody with kidney failures, usually potassium is the kidney is not able to regulate the potassium.
Okay.
And the potassium is usually very, very dangerous. High level potassium in the body is very dangerous to the patient, to the heart of the patient. Yes.
All right. So can one say that, or are there instances where a dialysis can be temporary? Because you started by saying that, sometimes it could be a lifetime affair, and there are others that are not dire. So that means it can be a temporary affair for some people or some patients?
Yes. There's a dialysis kidney failure we call acute kidney failure, which are most of them caused by something like malaria, vomiting, and diarrhea, excessive diarrhea. If you manage those patients very well, they do dialysis 3 to 4 times, and they usually resolve. The kidneys go back.
Okay.
Yeah.
And the situation is reversed in totality.
Yes. Yeah.
All right. That's amazing. You spoke about. Okay.
Yeah. We usually see they come and review the patients.
All right.
When the patient go to their clinics after a month, they refuse to see what is happening with the patient, and then if they say any adjustment want to do,
All right.
Yeah.
Just how expensive could this procedure be? Now that you said sometimes you'd opt for like a patient to go through the procedure twice, say
Twice per week, yeah.
twice per week
Yeah.
for purposes of saving cost.
Yeah.
Or,
Patient with NHIF card, they usually pay, the NHIF card pays for patient at 9,500.
okay.
But if you don't have NHIF, you usually pay cash, 9,500
That is per session.
per session.
Wow.
Per session. So per week, that was almost 19,000.
Okay.
Yes.
All right. So, and that is inclusive also of some other medication, or I mean, at that point again, you need to get extra medication
Yes.
to keep you going.
Yeah.
What is this one thing that one needs to do if they know very well that they are a patient who, has to undergo a dialysis like on a weekly basis?
Yeah. This patient they should make sure their card they pay the NHIF card.
Okay.
They should be up to date. And also, this patient also should always follow nutrition counseling, because even most of the patients here, we come and remove a lot of fluid. They retain a lot of fluid.
Okay.
When the kidney fails, when you take fluid include water, milk, any fluid, they usually retain.
Okay.
So this patient should usually limit the water they usually take. We usually prescribe that a patient, if possible, you can measure his urine in 24 hours.
Right.
And he had 500 mils on the urine he has measured, so that's the amount of the fluid he's supposed to take. Because most of them, their kidney fails to remove the water. So most of the patients, when they come here, their body are being swollen, or they have what called edema. The body, some have difficulty in breathing,
Okay.
because of the fluids which has blocked the lungs. So they're not able to breathe unless they're being done dialysis, so that they can come back to the normal state.
Okay.
Yes, yes.
All right. So after trying to manage, and maybe it appears like one has to go through a dialysis.
Yes.
At what stage would you say this is recommended? At this point now, we have tried this, we have tried that, and therefore it is now time that we recommend a dialysis.
If the patient, we usually look at what called urine output. Patient with kidney failure, the urine is very small. So there's a time the urine diminishes until this patient is not able to produce any urine.
Yeah.
So that's at the time now you can say now this one, because he's not able to produce the urine, so the urine is inside the body, so
Okay.
it's very toxic in the body. So that they need dialysis. That's the time now we are going to come to dialysis. Others they usually have what we call a difficult breathing. Others they have what we call hyperkalemia, high potassium levels. That's now there's no treatment unless we do dialysis.
Okay.
If you don't do dialysis, you may lose the patient. Yes, yes.
On what instances would you not recommend a dialysis? In as much as probably the situation is dire and...
Unless you see the patient is producing enough urine, and also we usually do what we call UECs, urea electrolytes. That's the one which can guide us. We see the level of the ureas, the level of creatinine levels. Those are among the baseline which usually guide.
Okay.
Yeah.
And so, say I'm at home and probably all of a sudden I'm not feeling well.
Yes, yes.
What are the signs and symptoms of, a person who's likely to have kidney failure? What are some of the things that you need to look at to know that there's a danger and maybe I need to seek medical advice?
Most of if the patient complains of reduced urine output, the urine used to produce a urine. Many urine used to go to toilet 3 to 4 times a day. So you're now reducing even to once a day, or even none. And also you'll see the body of the patient is swollen.
Okay.
Yeah, with edema. And also some of patients they complain of chest pain.
Yeah.
Yeah.
At this point, then you need to seek medical advice.
Yeah.
All right. I see we have some things there, some pipes.
Yes.
Is that water or what? Probably you can take us through, a quick review of what plays out here before we close it.
This is what we call acid concentrate. These are the things we're using.
You can just hold it up, no problem.
Yes.
Or, yeah.
These are what we are using in dialysis in the machine.
Okay.
This is what we call acid concentrate.
That is water now.
Acid concentrate, not water. This is not water.
Okay.
This is from a company. It's being manufactured from a company. They manufacture, and also there's some electrolytes which are being
used incorporated.
Incorporated in this fluid.
All right.
And also this is called bicarbonate. This is the base.
Okay.
Sodium bicarbonate.
Okay. Yeah. Oh, the kawaida sodium bicarbonate?
Yes.
Okay.
But there's some electrolytes also. They are being incorporated inside. And also this is what called bloodline.
Right. Oh, yes, the lines, these ones that you were talking about.
This is where the blood is going to pass from this red one. This remove the blood from the patient.
Okay.
From the patient now.
And now that the patient has already left, it means you have to remove all this?
This one,
why not remove while we're seeing? Oh, that is a procedure that needs time and...
See, after I will remove after we finish with you.
After you finish, why can't you do it when we're here? It's a bit complicated or what?
I will do.
You will do it?
When we finish, I will do it.
All right. And then there's the blood lines. Okay.
This is where it removes the blood from the patient.
Okay.
And also after the blood is being cleaned using this dialyzer.
Okay.
The urea, the creatinine level are being removed. They usually go to the sewage line.
All right.
Through the behind the machine, there's a pipe there. For this pipe.
No, it's fine. We're going to check.
There's a pipe there.
Yeah.
When the blood has been cleaned by this dialyzer, the clean blood goes back to the patient.
Okay.
And those ureas, creatinines are being removed. They go through the sewage line.
When you're saying that blood goes back to the patient,
yes.
Are we talking about a scenario where blood is entirely drained from the patient or what?
This one, this is the red, this red line.
Okay.
We shall put on the catheter of the patient, where this catheter is being inserted in a very big vein here, a jugular vein,
yes,
subclavian vein. So the blood usually come. The blood which are very dirty, they are dirty because they have those urea, creatinines. They are being removed. They come through the machine. They go through the dialyzer. The dialyzer cleans the blood. After cleaning the blood, the clean blood go back to the patient.
So that means a patient is not able to pass urine normally?
When?
When they're going through a dialysis or normal, after they're out of the dialysis, are they able to pass the urine normally?
It usually depends on the stage of the kidney failure.
Okay.
Yes.
All
Some
right.
patients pass urine, others they don't pass. There's even a patient who can stay 2 to 3 years without passing urine. Yes.
Okay.
Yeah.
Well, hence the reason why they have the catheter. Okay. Well, fair enough. I guess we have something else that we need to
This
see.
is the dialyzer now.
Yes.
This is like the artificial kidney. This is where all the procedure is being done, cleaning the blood.
Okay.
Yes, this is like the kidney we have inside the body. Yes.
Oh,
So
okay.
it's artificial kidney.
It's artificial.
Yeah.
All right. And so at this point, the kidney right inside, what happens when this is taking up its
The
job?
kidney inside already is not
It's failed.
It's failed.
But you've said
It's not-
sometimes on instances it's not failed in totality.
Yes.
Okay. All right, Dr. Thank you so much for speaking to us. I hope we have gotten the basics of this.
Yes.
This is what you expect once you get into the, a dialysis unit or renal unit. And I mean, you would meet people like Dr. George, who's a nephrology nurse for such. Is it a painful experience or process?
No, it's not painful.
It's not painful.
Yes.
So once you sit
The
there,
painful procedure is only when the pipe is being inserted, the catheter.
okay,
Yeah.
which is normally done once or
It's once.
it's once.
Yes.
Once in a lifetime, or after a while, then you'd be having
Once
to.
it depends. In case it blocks, you can it's a bit to be reinserted again.
Okay.
But it's once if it's working, and also we have what we call fistula. These are usually this is being done by cardiothoracic surgeons.
Okay.
They fix they combine artery and vein, and we can use that one as the catheter to do the dialysis.
All right.
Yes. That's what called permanent. Yes.
Okay, well, once again, nephrology nurse, Georgia, thank you so much for speaking to us.
Okay.
Remember, we are coming to you right from the Ruai Family Hospital, where, of course, we have been going through the process of a dialysis, not going through it as such, but just getting to learn all the basics once you get into a dialysis unit or the renal unit and what it is that you get to expect. Once again, I hope we can have some other time where we'll then get a chance to see the actual procedure. But as of now,
47, the home of
Despite being visually impaired, he is a jack of all trades. It is our quest to find answers on how to take care of children with special needs and those with disability. You do not need to see musical notes to understand music, but rather to have your soul feel the vibe.
Actually, for us to make a wheelchair, we have to take measurements of the user.
After doing my assessment, I get to know the parent, I get to know the heaviness she's carrying.
Disability comes at different stages of life.
How well do you know what's happening around you? Morning Cafe with heated political debates. Baraza la Siasa.
Hiyo kitu azungumzie, angalie hali ya maisha ya watu.
Informative health discussions. Business. Farming. Tasty Wednesday. Fitness Thursday. And Feel Good Friday. With amazing DJs, celebs.
Waimbaji, kuna comedians, alafu kuna wajinga.
And music bands. Every Monday to Friday from 6 a.m. to 9 a.m. The next set of millionaires are farmers, as we know agriculture has been and still is the backbone of our economy. As we traverse the different counties to meet different farmers, we ensure to get the story of how they started farming and even how they continue to penetrate the market and overcome the challenges.
Hapa, the reason why nilieka goose na si ducks. Goose, they are very easy to maintain.
A lot of farmers keep on calling, inquiring whether you're supposed to raise some seeds in the nursery or you're supposed to do them directly in the field.
The greenhouse helps us control the temperature because the temperature needs to be between 28 to 32 degrees.
Walk this journey with us every Sunday at 6:30 p.m. It's no secret, construction ain't cheap. But how do we make it affordable? Different individuals are finding ways of cutting down cost by use of pre-stressed slabs other than reinforced concrete, recycling plastics to make pavers.
The brick is stronger, it's cheaper, and it's lighter.
And recycling wastewater in your household.
What happens to my waste from the washroom, the solid waste? All that can break down.
Those are just but a few. Every Tuesday at 7:30 p.m. we talk construction.
There's no alpha without an omega. There's no lead without any followers. No man is an island. We need each other. We need this conference.
We say it, we do it, we act it.
Kama una mpenzi wako, kila siku kama nilivyosema, kila siku mwishi mapenzi.
We don't toe the line, we set the standard. We don't eat the grass, we lead the pack.
As an alpha male, you're also a leader. Not to just women, friends and family, but to everyone else you've never met before.
We are the beauty, the spice and the brains. The men's conference where men become alpha males.
And you can catch us every Wednesday at 10 p.m. This is The Grind. Only those who will risk going too far can possibly find out how far one can go. T.S. Eliot.
So I decided, let me just take this up, put the teaching on hold first. Let me try see where this can go.
I mean, the opportunities are a lot.
But is that all you need? Oh wait, there's more. This seems a little too much. Let's slow it down.
You do this is something you do out of passion.
Join me, Violet Njaki, as I navigate through the maze of the increasingly dynamic business environment and quiet down the noises, as I help you flourish in business every Monday at 7:30 p.m.
It's no secret, construction ain't cheap. But how do we make it affordable? Different individuals are finding ways of cutting down cost by use of pre-stressed slabs other than reinforced concrete, recycling plastics to make pavers,
The brick is stronger, it's cheaper, and it's lighter.
and recycling wastewater in your household.
What happens to my waste from the washroom, the solid waste, all that can break down.
Those are just but a few.